So we hear so much information about COVID-19 these days, and it leaves us anxious and fearful. Here to help us sort it all out is ABC News Chief Medical Correspondent, Dr. Jennifer Ashton. Dr. Jen, thank you so much for being with us. Of course,
Thanks for having me.
this constant news cycle about the pandemic can definitely leave us all feeling exhausted.
Totally exhausted. I mean, not only the mental fatigue, but physical quarantine and pandemic fatigue. But you guys are handling it very well, I might say.
Well, we
Thank
are
you.
we are at times exhausted. I wanted to ask you about this article I read, Dr. Jen, the Oxford COVID-19 vaccine and the trial results. The headline is very promising. So how excited should we be about this one vaccine?
Well, Ryan, I think when you talk about the vaccine developments worldwide, there are well over 100 developers that are working for these vaccines. There are at least 4 that are in phase 3 clinical trials, which is, of course, good news. But you know, it is so important to take a realistic view. We've heard the words cautious optimism. That is appropriate. You have to go right down the middle, because the last thing that we want is, whether it's in the lay public or the scientific and medical community, we don't want people to have false hopes or unrealistic hopes and then come January, February 2021, be completely devastated. So the phase 3 clinical trials are going well. That is really testing large numbers, like 30,000 people, for safety and efficacy. And both of those are of primary importance. This vaccine will not get the green light from the FDA for emergency use authorization unless it is shown to be protective against SARS-CoV-2 and safe, both short-term and long-term. So they're going to be enrolling like 30,000 people for each developer, and we'll be waiting for those results. So far, it looks good, but again, there is a lot that has to happen between now and that vaccine being available for the general public.
Here's
Well,
hoping.
fingers crossed.
I know you interviewed Dr. Fauci recently, and he was reemphasizing that the virus can enter our bodies through our eyes, which I'm really trying hard not to touch my eyes, but it's not easy.
I
Yeah.
know it's not easy, Maria, but listen, just when we thought we couldn't get any more inundated with ways to protect ourselves, we're just getting used to the routine wearing of masks in our country and in our society. But what Dr. Fauci was telling me is basic scientific and medical fact, which is that this virus enters our body through mucous membranes, which we have not only in the nose and mouth, but in the eyes. So he was crystal clear that if people want to take every step they can take, that eye protection of some sort, whether it's glasses like these, which I need to see, or goggles or a face shield, while not a universal recommendation, is a good idea.
What about, there's a study that just came out that talks about the effects on the heart after one has had COVID-19. What can you tell us about that study?
Yeah, Ryan, and this got a lot of attention in the medical community. It was a small study done in Germany. They looked at about 100 patients with all types of COVID-19, mild disease, severe disease. It was published in JAMA Cardiology, and they did MRIs of the heart up to 3 months out on all 100 of these individuals, and they found that 78% of them had some sort of persistent cardiac involvement. 60% of them showed signs of inflammation of the heart. So at this point, we say this all the time, but it's important. We need more long-term data. The key take-home with this finding, I think, is really that we don't know the long-term effects of this virus.
Yeah.
So people having symptoms of their heart, any kind of cardiac symptoms, should have their awareness up. And it may be that we see some recommendations for long-term follow-up, but we don't know yet.
We'll follow that. Let's take a break. We'll come back with more with Dr. Jen right after this.
So, Dr. Jen, we've been talking about COVID causing anxiety and fear, but apparently there may be some good news about the upcoming flu season.
Yeah, I mean, first of all, Maria, I'm glad you mentioned again the anxiety and fear, because if we don't recognize the psychological aspects of this pandemic, we really can't address the physical aspects, because the body follows the mind. So that's really important. There is good news. We're always looking for a silver lining, and potentially we may actually see less influenza, less other circulating infectious diseases this flu season because of all these steps we're taking, like distancing and more hand washing and masks. And I just want to also include, because I heard you guys talking about the mask issue before with our dental health. The dehydration factor is so real. I can attest to that. When you wear a mask for hours upon hours, you literally feel like you're crawling through the desert. But I just made an appointment for my dentist for a cleaning, which for me is a real white knuckle experience, like for so many other people, because we do have to remember our oral health is super, super important. So you can't avoid the brushing, the flossing, and the dentist just because we're in the pandemic.
Okay, good advice. Now, help us understand the testing. Is it getting any better? Where are we? And then the thing I'm trying to understand, Dr. Jen, is so if one gets a test and the results come 10 days later, how accurate and valuable is that test?
Oh my God, so much to unpack there, Ryan. First of all, the end of your question, how valuable? Not very. We need those results in real time to be able to act on the test results, especially in people who are getting a test for the purposes of diagnosis. We're going to start to hear differences between diagnostic testing and surveillance or screening testing. Where are we right now? Slightly better than we were in the spring, no question. We were starting around 1 million tests a day in April in this country. Mid-July, we were up to about 4.5 million. There are some infectious disease specialists who say we need to be at over 30 million tests per week in this country to control this virus. So they need to be available, they need to be free or cheap, they need to be accurate, and they need to give us a result fast so that we can act on those results. So we have a long ways to go.
And she emphasizes long. And you are on television 24/7 through all of this. We appreciate your availability and your insight as always. Be sure to check out Dr. Jen's show, What You Need to Know, on ABC. We'll see you soon, okay?
Thanks, guys.